Hello, I'm Dr. Jeff Rodriguez, faculty member of the Long Beach State University Doctor of Physical Therapy program and Director for Admissions. And this is the online version of our advisement session regarding admissions information. Here at Long Beach State, we have been written up in numerous publications regarding the value of our education at a great price. We hold that very highly, and we feel that we can give our students the best education for the best price around. So what does it take to become a physical therapist? Our program is a full-time 3-year program. It consists of full-time classes taken during the summer, fall, and spring semesters. We have your normal classes such as anatomy, physiology, biomechanics, orthopedics, neurology, cardiopulmonary. We have classes that run the lifespan in regards to pediatrics and geriatrics. We even delve into business and professional ethics, and so on. One thing that sets our program out from other programs is that we do have a required doctoral research project. This takes place during the fall of the second year, spring of the second year, and fall of the third year semesters. It is required for graduation. It is, as I mentioned, it is three semesters, total of 4 units, and you work with faculty members on research projects. I will go into a little bit of that later on in this presentation. And we also require clinical internships. They are 36 weeks in total, 3 12-week internships that you will go through while in this program. You must have completed your undergraduate degree by the fall semester of the year that you are applying. Also, any prerequisite courses you are taking must be completed by the fall semester of the year that you are applying. We strongly recommend that if you are taking prerequisite courses in the fall semester of the year that you are applying, that you take no more than 2 prerequisite courses during that semester. This is a recommendation, not a requirement. When completing your application, you will need to have the following information in: your bachelor's degree, and we look at your cumulative GPA. We also look at the required prerequisite courses, and we look at that prerequisite course GPA. We look at the GRE scores, and we have recommendations for the GRE scores. Your experience hours and sites, your letters of recommendation, and your personal essay. We take all this into consideration when reviewing your application. We feel that we take a holistic approach to the application process. We feel that we are admitting students and people, not admitting numbers. First thing, your bachelor's degree. It must be from an accredited institution. While most of our applicants have degrees in either kinesiology, exercise science, or biology, to us the undergraduate degree does not necessarily matter. We've had several students who have come to us with backgrounds in economics, business, English, dance, and other varied degrees and backgrounds that have done very well and have succeeded very well in our program. So the degree does not necessarily matter as long as you've completed a degree from an accredited institution. We require a minimum overall cumulative GPA of a 3.0 or higher. When you submit your transcripts into PTCAS will take all those grades for every university and college that you attended, and they will take all that information and they will calculate your cumulative GPA. If you've taken a class over for a better grade, for example, if you took a chemistry class and you got a C in that class and you wanted to retake it to get the better grade, and the second time around you got an A, PTCAS will take all the courses, including the ones that were repeated, and use all that to calculate your GPA. So that initial course and the repeated one will both be used in your cumulative GPA. The prerequisite courses that we require are listed here. We require a year of biology, a year of anatomy and physiology, a year of chemistry, a year of physics, 1 course in stats, and 1 course in psychology. This here is a list of the courses that are at Long Beach State that would meet our prerequisite requirements. I have these listed here because you can take this information and look at the course catalog for Long Beach State and see the course descriptions listed there to see if and you can use that information to see if the class you took, how well does that course description match up to what we have listed on our catalog for these courses. If they match up and they're very similar, odds are we will likely take that course as meeting the requirements. If you go to our website for the physical therapy department, which will be at the end of this presentation, you can go there and you can see the course descriptions listed there also, if that makes it easier for you. But these are the courses that these are some of the courses that we would meet our prerequisite requirements for the DPT program. The prerequisite courses, some information on those. All the biology, chemistry, anatomy, physiology, and physics courses must have a lab section. And they must be for science majors, allied health majors, etc. If you look at Long Beach State's catalog and you look at Biology 200, it's a general biology course. But in the course description it says for non-science majors, meaning that is the general elective course that is needed for graduation for those not in the science majors. So that course we would not accept. Okay, so you need to look at the course descriptions, make sure that they say for science majors, allied health majors, etc. We do allow some substitutions for some of the prerequisite courses that were listed there. We will take microbiology as the second biology course. We'll take organic chemistry or biochemistry as the second chemistry course. And you can substitute abnormal psychology for general psychology. All the prerequisite courses must be taken within 10 years of applying, with the exception of anatomy and physiology must have been completed within 5 years of applying to the program. We do not go by the semester, we go strictly by year. So if this is 2020, as long as you've taken that anatomy and physiology course between now and 2015, it will be acceptable. If it was taken anywhere 2014 or later, then we will not accept the course, as an example. We do require that all labs be in person. Now, we will make an exception for the COVID-19 pandemic, and that is that prerequisite courses that were taken during the spring 2020 and summer 2020 terms, if those courses, if they happen to have those prerequisite courses, if they happen to have a lab, we will accept the online lab for prerequisite courses taken only during those terms. So spring of 2020, summer of 2020, for those terms we will accept online labs for the prerequisite courses due to the COVID-19 pandemic. If you're not taking your prerequisite courses at Long Beach State, they must be taken from an accredited institution. And I would strongly suggest you check the course description at your college or university and compare that to what we have here at the Long Beach State catalog. Make sure that you have a lab also for those science courses like we just mentioned. I would also strongly recommend that if you have any questions, talk to your undergraduate advisor at your college or university to see if the course that you took matches up with what we have here at Long Beach State as a prerequisite. They will be able to help to probably decipher that information better, and that would be probably the first thing I would recommend going to if you're not sure about the classes that you took. Once again, make sure those science courses are either for biology majors, science majors, allied health majors, etc., as we talked about. The statistics course, we like it to be scientifically based, and we usually like to see things that are courses that are offered through the math department, psych department, and biology departments for the stats. But if you have a course in elementary stats or business stats, we will accept that. We want to make sure that you have a statistics course prior to or when you're applying as a prerequisite course for our program. If you're taking a course at a community college here in California, you can use the website assist.org, and you can take your community college and compare that to what is at Long Beach State and see what the equivalent would be at your community college to what that equivalent course would be here at Long Beach State. You can go back to a couple slides back to the list of courses that are prerequisite courses here at Long Beach State. You can see if the community college course matches up with the course that is listed on the presentation. For the prerequisite courses, we require a minimum GPA of at least 3.0. We will calculate your prerequisite GPA based off the transcripts that you submitted to PT-CAS. If there was a course that was retaken for a better grade, I gave the example earlier of a chemistry class where you might have gotten a C and you want to retake it and you did and you got an A. We will take the higher of the two grades in calculating your prerequisite GPA. For the spring 2020 and summer 2020 terms, we understand that many universities and colleges are given the option of credit, no credit, or pass, no pass in regards to courses taken during that time. In regards to the prerequisite courses, we strongly recommend that in those prerequisite courses that you have a letter grade for those courses. We will accept credit, no credit, pass, no pass, whatever format your university or college uses, but we strongly recommend that those prerequisite courses have a letter grade. That is our COVID-19 exception. And we'll only do that we'll only accept the credit, no credit grades for the spring 2020 and summer 2020 terms in regards to prerequisite courses. All prerequisite courses must be completed by the end of the fall semester of the year that you are applying. If you are taking courses during the fall semester, and we know they are in progress, we will continue to review your application and we'll put that off. We will notice that you are doing classes in the fall semester. We will then take your application, put it to the side, and wait for the information to be uploaded through the academic update window, which for PT-CAS will be about mid-December. And about mid-December, PT-CAS has a time open where anyone who is taking courses during that fall semester can upload those courses and those grades. And once those are verified by PT-CAS, we will then move forward with the review of the application. For those taking prerequisite classes in the fall semester, we put a pause on your review until that information gets in before we move forward with it to make sure that you've met all the criteria. Courses, as I mentioned, courses must be verified by PT-CAS when you are putting those grades in. So the recommendation I would make is if you're taking classes during the fall term, to have those grades expedited and sent over to PT-CAS as quickly as possible, as soon as that semester is done, as soon as the grades are posted and available. We do not accept applicants who have prerequisite courses in progress in the spring term or semester or quarter. We will not do that. It is into our acceptance cycle at that point, and we will not accept applicants with prerequisite courses in progress during the spring. The GRE is required. We require that it's taken within the last 5 years of the year that you're applying. So as I mentioned earlier, if this is 2020, you have to take we will accept any GRE scores that were done between 2015 and 2020. If it's 2020, you took it, or 2014 or later, then we will not accept those scores. We do not cherry pick the scores. We will take the best overall score by date, meaning that if you took the exam, the GRE once, and you did really well in one section and not so good in another, and then you go back and you stress your studying on the one section you did poorly in to get a better score, but then the other areas you drop off on, we will not sit there and cherry pick date by date by date. We'll take the overall best score per date. Our recommendations, these are not requirements, but recommendations. At least a 4.0 in the analytical section, and at least a 150 in the verbal and 150 in the quantitative section. You can take the GRE as many times as you like, but we recommend normally that you take it no later than 1 month prior to the PT-CAS deadline. This allows processing and verification of your scores. It takes PTCAS about 4 weeks from the time they receive the information from ETS to be able to verify your scores and post it on your application as such. We will not accept unverified scores, so the best thing to do is to give yourself some time, take that GRE exam at least a month before the deadline, and the deadline is November 1st, so we usually tell people don't take it any later than October 1st. Now, we do have a COVID-19 exception just for this application cycle, the 2020-2021 application cycle. We will accept the at-home GRE as it is being provided by ETS, and PTCAS is in agreement with that. So we will accept that at-home GRE score, and because of the application process and whatnot, we say because of this cycle only, because of the COVID-19 exception, we recommend you take it no later than November 1st, the close of the application process. If you take the GRE after November 1st, we will not consider that score, and we will not consider the scores until the GRE scores are verified. So you may take the exam on November 1st, and we will put your application to the side and wait for those GRE scores to be verified. Once they are verified, then we will continue on with our review of the application. So it is on you, the applicant, to make sure that the scores that when you take the exam and when the scores are being verified, and following up with PTCAS on your GRE scores. We do require a minimum of 100 experience hours. There is no minimum number of hours per site required, but we do recommend multiple sites to get your hours. There's many different settings that PTs work in, and I have some listed there. A lot of diverse settings. As you can see here is kind of a more detailed list. A lot of different areas that PTs practice in at this point in time, and we feel that because your education here, when you come out of this program, you come out with a general education in physical therapy, and you will be exposed to many of these types of settings. We want to make sure, we would like to see our applicants have experience in all those varied settings. It shows us that you've taken the time and effort and energy to review the different areas with which PT works in. If you have all your experience hours in one outpatient clinic, that is not going to hurt you, but diversifying yourself and going to different areas will only help you. And this is because we work with a lot of different types of patients, as you can see here listed, a lot of different types of patients that we're involved in, and it's a lot of different areas in PT that you can venture into. The thing I like to say about this job is if you're getting bored with this job, it's because you're not trying. There are so many different areas that you can go to and work in and get experience in. It is a pretty unique type of job to have. So as we mentioned, you have to have a minimum of 100 hours, but we will give you credit up to 400 hours. In our rubric, we have it set up for different levels from 100 up to 400 hours. Once you get after 400 hours, you can go above. That's not going to hurt you, but it's not going to help you either. We had to put a cap at the number of hours so that we picked 400. For the different sites, like I mentioned, all the different areas that PTs work in, we like to see you have some variety. You have to have at least one site to get your hours in, and we will give you credit for up to 4 different sites. So once again, we had to put a cap at it, we capped it at 4. You can have more sites, that's fine, that's not going to hurt you, but we had to put a cap somewhere, so we put it at 4. There's no minimum number of hours at any one particular site. You can have a variety of hours at different sites. We just say that you have to have a minimum of 100 and a max of 400, and the different sites, a minimum of 1, a max of 4. Letters of recommendation. We require 3. Ideally, we like to have 1 needs to be from an instructor, and we would prefer someone who taught one of your prerequisite courses. This is due to the fact that they probably have more insight into the profession, and they could give more insight about you for us. We also require one from a licensed physical therapist who did observe your work through your experience hours. We will not accept letters of recommendation from an MD, a nurse, a OT, a case manager, an athletic trainer, a PT assistant, things like that. We will not accept that. So it needs to be from the physical therapist who observed your work while getting your experience hours. The third one we'd like to see from an employer, because they give us a different picture of you, but it can be from another physical therapist or another academic source if no employer is available. These letters should include things in regards to your character, communication skills, your background, your leadership, things like that. We would strongly recommend that you get a letter of recommendation. Doesn't matter the name per se. It could be a very famous professor on your campus that you want to get a letter of recommendation from. But if they don't know you very well and have not interacted with you well, that's not likely going to not be a very strong letter. They will not be able to speak to your high points and things such as your character and whatnot that would lead to having a good letter of recommendation, a strong letter of recommendation. We also require the personal essay, which is the prompt that is provided by PT-CAS. This allows a chance for you to paint a picture of yourself for us. We do not do interviews, and I will explain why coming up here. Ideally, in this essay, if you can get across in the essay while still answering the question, the prompt, why you're interested in this profession and why do you want to put yourself through 3 years of graduate school, more likely just after recently finishing up with undergrad, why do you want to go to school and do 3 more years of very hard and intense work? Try and give us a good overall impression of yourself. It lets us, the reviewers, get an idea of who you are. As I mentioned earlier, we take a holistic approach to the review process. We are admitting people, not numbers. So we want to know who we might be admitting or offering admission to our program. And like I mentioned, we do not conduct interviews with applicants. We use the letters of recommendation and the personal essay as ways to get to know about you. We do score them. They are an important part of our application process. So brief summary, you have to have your bachelor's degree completed. The overall GPA needs to be at least a 3.0. The prerequisite course GPA needs to be at least a 3.0. You have taken the GRE within the last 5 years. A minimum of 100 experience hours. The 3 letters of recommendation. The personal essay. And you need to complete 2 applications. The application to the department, which would be the PT-CAS application, and you also need to complete a supplemental application, which is to the university itself. You need to be admitted. You need to meet qualifications to be admitted to the university and to be admitted to the physical therapy program. That secondary application is the Cal State Apply application, which I'll go over here shortly. But both need to be completed by their respective deadlines in order to be considered for admission. So when you go to apply, as I mentioned, there's the PT-CAS application, and that opens the mid part of June, and it goes till November 1st. All the information needs to be in by that deadline on November 1st, and please understand that November 1st deadline is midnight November 1st, but it's midnight East Coast time. So here, if you're living here on the West Coast, it's 9 o'clock p.m. So you'd have that information in. I've had many people in the past who've contacted me who said they submitted their application before midnight, just before midnight, but they lived here on the West Coast, and their application wasn't accepted because they missed that deadline because the deadline was 3 hours earlier because of East Coast time. The Cal State Apply application. You can see the link that's there. That opens up October 1 and it closes January 15th. You need to meet all that requirements for that application also to be considered for admission to our program. In the past, I've had several applicants who've looked great on their PT-CAS application, someone who I'd love to have in our program, and they miss Cal State Apply deadline. And if you miss that deadline, there's nothing you can do. You can be the perfect candidate for our program. You miss that Cal State Apply deadline, you're not going to be considered for admission. Okay, so please understand that both need to be completed. I will say that on the Cal State Apply application, in brief, you have to submit your transcripts, your GRE scores. There's a portion there that asks for a personal statement, and you can, and we have this information on our website, but you can submit, you can write in the term, already submitted through PTCAS, and that'll be sufficient. When it asks for letters of recommendation, you can also just enter in already submitted through PTCAS, and that would be sufficient. And so that's in brief the Cal State Apply application. For our out-of-state students, we do not give preference for in-state or out-of-state. We look at the best overall student. That's who we admit in our program. Traditionally, we have about 10 to 15% of our cohort does come from out-of-state. And our out-of-state tuition is, there's out-of-state tuition cost at $396 per unit above the in-state tuition. And the first year consists of 44 units total. So if you can do the math there and figure out the difference there. After the first year, you can apply for residency, and from what I'm told, if you spent your first year here in California doing classes, getting residency is not a problem. So that's what I've been told. But you can apply for residency, and then that out-of-state tuition extra would be reduced, and you pay the in-state tuition fees. Anyone that has done any education internationally, then you would need to run your application through the Center for Professional and International Education at Long Beach State. You need to run it through there, along with getting the WES verification, and that would be done through PTCAS, I believe. So you'd have to do that. Now, if you did a semester abroad through your university, that is fine. You don't need to go through this step. We will, if your university accepts the courses that you took and the grades that you've got, we will accept that also. But if you do have your degree from somewhere outside of the United States, you will need to do your put your transcripts and through the CPI, that's what we call it here, Center for Professional and International Education at Long Beach State, along with everything else that you have to do. All the prerequisite courses, though, must be taken here in the United States. The exceptions that we have to that are prerequisite courses at a university or college in Canada. We'll accept that. So it is important that the applicant is aware of the dates and the deadlines and the information that is required. It is the applicant's responsibility to make sure that all the materials are submitted to PTCAS and to Cal State Apply on time. This includes your transcripts, your GRE scores, experience hours, letter of recommendation, personal essays, and whatnot. I strongly recommend that you start early with the application process and don't delay or don't put off till the last minute, as that is usually when things go awry and applications do not get completed. Any incomplete application will not be considered for admission. In mid-January, we begin to notify students of their acceptance in the program, and at that time we will also start our wait list. At Long Beach State, we have two wait lists, a high tier and a low tier wait list. This information is available on our website in detail, but in brief, the low tier wait list is for those applicants who have met all the requirements, yet their scores are below what we normally would accept into the program. This information is useful for those on the low tier wait list in that if you were accepted into another program and you are waiting to hear from us in regards to possibly being accepted here, please know that if you're on the low tier wait list, we will more than likely not be offering you an acceptance to our program based on your scores. That being said, if you have an offer from somewhere else, please take that offer and go. And please do not hold out hope for our program. Like I said, as I mentioned, you are a qualified applicant, but your scores are lower than what we normally would accept. If you're on the high tier wait list, you've met all the requirements, and your scores are in the area of those that we'd like to accept into our program. And those people on the high tier wait list are the ones that we will be considering for admission once spots become available in our cohort. So you do have a possibility of getting into our program off the wait list. All that being said, we do not give out information regarding someone's position on a wait list, either high tier or low tier. We do not do that, as the wait lists are very fluid and they're constantly moving, and to give you an answer on what number you are, that number won't make much difference depending on many different variables. So we like to say that we do not give out wait list information, as in position on the wait list. What can you do to help increase your chances of being accepted? Well, in order to help improve your chances, we recommend that your GPAs, your cumulative and your prereq GPAs, be at least 3.5 in both to be competitive. I will say the last 5 years, the average GPA, cumulative GPA of our incoming cohorts have been around 3.7 and above, and the average prerequisite GPA of our incoming cohorts has been also about 3.7 to 3.8 over the last 5 years. So you need to have that. Being below 3.5, you have to have some other things that make you a very strong candidate to be considered for admissions. But if you're below 3.5, it's going to be very difficult. Having experience from different sites from experience hours is going to be very helpful. As I mentioned, you have to have a minimum of 100 hours in one site. You can have up to 400 hours in 4 different sites. And if you have that will help to improve your chances in regards to admissions. Getting letters of recommendation from those that know you very well will be a key thing. They can speak on behalf of your character, your background, your leadership, things like that we value highly. So it is important to have someone who can speak on those points for you. And that personal essay, give us some insight as to why you want to do this and what it is about you that makes you want to become a physical therapist. We want to know about you, the therapist, or you, the potential therapist, in this essay. So those things we do take into consideration when reviewing your application. Why this information is important? For our cohorts annually, we have about 1,500 that initially apply to our program each year. Out of that, 900 plus will have completed their application and have got all the information in that is required. Out of that, we have about 400 to 500 that we consider highly qualified applicants, and from there we will admit 36 students. So our program, some insight on our program here. This is our curricular sequences for the class of 2022. As you can see, it's 3 semesters per academic year for us. It starts in the summer, it goes summer, fall, spring, and it is full-time. It's a 3-year program, and the overall 118 units to complete the degree. You can see there how things are split up, how things are broken down into summer, fall, spring for each year. We have a great reputation in the field in regards to our physical therapy program here at Long Beach State. Our faculty are all PhD and DPT prepared, and we emphasize a lot on teaching. We also like research. We're also into clinical application and still clinically seeing patients, but our emphasis is on teaching. We appreciate that, and we feel that we are strong in that regards. We think a benefit of our program is a small class size. We get to know our students very well. We get to interact with them closely in regards to lecture and lab, and we feel that makes a strong relationship between our faculty and our students, and we feel that is a big benefit. There are many hands-on opportunities that we have available, and we feel that the cost of our program, as mentioned earlier in this presentation, is definitely a plus for our program. On our program here, this couple pictures showing our new acute care lab. It's our new simulation lab. We have 4 high-fidelity simulated mannequins, and we use this lab and the mannequins in various classes throughout the program. So And see here some of our mannequins as they're set up. They are a great teaching tool for our students. Our students appreciate the time that they can take in practicing certain skills with these mannequins that cannot be mimicked by an actor or a fellow student. We can do certain things with these mannequins that our students can learn from, and when they go out into the clinic setting, they're better prepared, and we like that we can give that and offer that to our students. We also have right across the hall from there, we have a brand new anatomy lab that just opened up in January of 2019, and we're very happy with this. It is this anatomy lab and the sim lab just mentioned are just for PT students. They're unique to the PT program. These labs are not shared with any other program on campus, so we are pretty pleased with the fact that we have these directly available to us, and we feel that that benefits our students and their learning. Some of the hands-on experiences we talk about, we do have the 3 12-week clinical internships, so a total of 36 weeks. A lot of our clinical courses also have hands-on activities, and there are things that are in these clinical courses. Some are done, like I said, with the mannequins. Some are done with standardized patients or actors. Some are done off-campus with real patients. And we also have an on-campus pro bono clinic, which you, as a student, would be participating in for 2 semesters during the second year, in the fall and spring semesters of the second year. And in this, we have patients who have needs for physical therapy, yet their insurance has run out. So they come here to our program. They're usually patients who have neurological deficits, and it runs a spectrum from pediatrics to geriatrics and anywhere in between. These patients are supervised by our clinical faculty member, and she also has 2 physical therapists from the community who come in, and they are all neurological specialists. They come in and supervise these students, and on any Tuesday or Thursday morning, you'll see the clinic running, and we usually bring in 6 or 7 patients at a time, and what it works out is that you and a classmate will team up and have a patient, and one of you will see the patient on Tuesday, the other one sees them on Thursday. You write your notes, you collaborate with your classmate on how you're going to progress the patient, what you saw during your evaluation, what your assessment is, and then how you're going to progress the patient along the way. It is done for 2 semesters, and you get graded on that in both semesters, and I think this is a really unique opportunity in the fact that you get to work with real patients with real problems while you're in school before you even go out to your clinical rotations. We also have a faculty practice here on campus called PT at the Beach. It's located about 100 meters from our main office, and there are different classes that you will take that will rotate through PT at the Beach, and you will go in and work with the therapist there and work with patients who are in the clinic at that time, and it's primarily orthopedic, and you will, when you go in there, you don't really know what kind of patient you're gonna have until you get in there and see who's on the list for that day. So the nice thing is it does keep you, you have to be well prepared, be able to work with the patient, and you get a lot of great feedback from that. We feel that ends up being a very nice learning tool for our students. We also have the research project, and depending on what kind of project you're working on, your subjects might be fellow classmates, might be people from the community, or it might actually be real patients that you are working with. And there's once again another example of some hands-on experience that you might have working with patients and whatnot that you have while you're in the program. The doctoral research project, as I mentioned, is required. It is 4 units over 3 semesters. You start in the fall of year 2, go spring of year 2, and then fall of year 3. And usually during summer of year 3, you're out in your clinical, so it's kind of hard to be involved in that. Yet there are many students who will, on the weekends or after hours when they're done with the clinical, they'll come over to the campus and work a little bit with the faculty member as needed on the research project. There are different labs that we have. We have a pathokinesiology lab at our disposal with a Vicon system. We also have the clinical rehab and biomechanics lab, or a CRAB lab, right next door to it, so that is also in use there. We also have labs that are affiliated with the kinesiology department here at Long Beach State, and a lot of times our faculty members will work with some kinesiology faculty on different research projects. Example of one of our faculty who likes to use ultrasound on the spine muscles, and an example of him looking at the cross-sectional area of the erector spinae at here at rest, and then during activation. So things like that. We have a gait lab also that we use, and depending on the patient population, we'll use these for various projects. An example of my research project that is wrapping up here is looking at sternal separation in those who've had sternotomy post open heart surgery. So example of my research students using ultrasound to measure the sternum, which you can see up here in our student. It's a nice straight sternum. It's nice and intact. In my subjects, the sternal separation we looked at early after surgery, which was probably about anywhere from 7 to 10 days after surgery. And then 2 months later, we came back and looked at them again, and we saw the sternum actually healing up. And we're looking at that in regards to sternal precautions, which is something you might be familiar with. A question that comes up often is the ability to work while in PT school. In all honesty, we don't recommend it. The main thing is because you're in class for several hours during the day and during the week. So you can see their example, probably about 25 hours during the week that you're in class. And then you have to add on top of that study time. And it's not just your own individual study time, but there's a lot of group study that goes on, group projects that go on that you need to be available for your classmates. You also need time for free time and relaxation to burn off some of that steam that you need, and includes being able to have some time left over to sleep. So all this being said, it is very difficult to work while you're in PT school because of the full-time nature of it. Please understand these classes are different than your undergrad classes. You're taking the same number of units, 15 to 17 units per semester, yet these classes are faster paced, and they're more depth and more detail, and more is asked out of you than an undergraduate course. So that being said, it is very difficult to do this. Now, I will say there are a handful of students that do work while they're in PT school, but the vast majority of them work maybe 3, 4, 5 hours a week, just from some extra change kind of thing, but no one works like you might have in undergrad, working several hours per week. As I mentioned, the cost for our program, one semester in our program is about $9,126, and that's per semester. There's 3 semesters per year, so you can see the per year cost about a little over $27,000, and our total cost is a 3-year program. It runs about just north of $82,000. Okay, so that is our program. If you compare our program to other programs in the area, you can see that we are a very good bang for your buck. And we are very happy that we can give a high quality education at a very low price. Once you're done with the program, you need to take the National Licensure exam for physical therapists. And you can see there on the top half the last 5 classes. In the class of 2017 and class of 2019, we had 1 person in each class not pass the first time. But compared to the national average, we are well above that. And once they took it a second time, they're able to pass. Each of those students, in the one in 2017 and the one in 2019, passed on their second attempt at the licensure exam. Below that, you can see our graduation rates for that same time period. And the nice thing about this too is the employment rate. 100% of our applicants within 6 months of graduation are employed as a physical therapist. So, and most are, I'd say probably half have jobs before they graduate. They have, you finish up with the last clinical rotation at the end of April, beginning of May, and after that, the students are usually out on job interviews or relaxing, what have you, but graduation isn't until about the 3rd to 4th week in May, so they have some time to go out on interviews and whatnot. And like I said, at least half our students have jobs lined up and everything at the time of graduation. So it's kind of a nice feeling when you walk across that stage, you know that you've already got your job set up, and it's kind of a good feeling to have. Okay. So thank you for your time. I appreciate you taking the time to listen to all this. If you have any questions, best thing to do is to contact me. My name is Jeff Rodriguez, and my email is up there. The department coordinator for admissions, my assistant Merlin Perez, her information is also there, so you can email either one of us questions, and we will get back to you as quickly as we can with the information that you need. If you have any other want to look at further information regarding our program, please go to csulb.edu/PT. That is our website, and you can look on the left-hand column under admissions, and that will give you more information about admissions, but also more information about our program in total is there. I hope this information has been helpful for you, and I hope that this will help you put together a good application and help to have answered any of your questions so you can put forward a good application. Good luck. I know it's very difficult. I know it can be tough, but hopefully this has been helpful. Good luck with everything. Thank you. Bye.